In terms of Mo, you know the data as well as anybody. Are there any significant reductions in transfusion requirements, length of stay, perhaps cost? I know Alan Barkan had a cost effectiveness study that suggested that this is the preferred modality to treat GI bleed patients. But any thoughts on transfusion requirements, and which is a big thing in North America? We have committees and institutional policies on those. And of course, the health economics that we deal with today, the length of stay is a very important metric. Any comments on those points, please?
Yeah, thanks, Dr. So that's something we're looking into at the moment, actually, in terms of the health economics and length of stay. So we're crunching the data for that at the moment. In terms of transfusion requirements, we've looked at the data, which was something we'll come on to later, the malignancy cohort. But we didn't specifically look at it in the peptic ulcer cohort of patients. Just in terms of some of the figures, just alluding to what Rehan mentioned earlier. So with the monotherapy cohort, with the overall so about 25% of all the patients with peptic ulcer bleed, the vast majority, almost 90%, were Forest 1A and 1B, had monotherapy. And in that 25% cohort, only 16% had a rebleed within 30 days, and therefore obviously required another endoscopy. And in the combination cohort, which is about 50% of all the patients with peptic ulcer bleeds, there was a statistically significant reduction in mortality. The most promising results were in patients with combination of Hemospray and adrenaline, which is interesting because that's in keeping with the literature where they always recommend that adrenaline combination with, say, mechanical therapy or thermocoagulation. So look, in the coming weeks and probably for the next DDW, we're crunching the health economics and cost analysis because we will have all the data for length of stay for all of these patients to see how truly effective the cost analysis is compared to standard of care. And I think, as you alluded to, Dr. Barkan had a manuscript on this, and I think this will be quite important in the overall picture of this.
Yeah, that's an interesting paper came out some time back, and I think I would refer the audience to look at that. Yes, it's just one study, but I think it's reasonably well done, and it speaks to the fact that combination therapy, at least, was in that particular model the way to go.